Well, but yet I thought the thought that you gave is not bad.
Oh, thank you.
But you look a bit down,
Yeah, actually, I really feel very, very, very bad now.
Oh.
You know that the paper I wrote on mental resilience. No, talk about it. I just received the letter from the publisher. No, I got rejected. No, I thought you reject my journal, and I think it's part of my life lah. The same story over and over again. No, and the same feeling I felt many years ago when Mr. Tan, our teacher,
our English teacher.
Yeah, English teacher. Yeah, he at time when I did so poorly for my prelim exam, he scolded me, saying that you're so careless, you never succeed in life, you are so careless, and I really felt so bad and insulted and humiliated, Actually, frankly, I wouldn't be here if I didn't do well in my
So you can see that 30 years ago, maybe that was true lah. Okay, so in that club of life at that time, Mr. Tan was important, right? But today is different. So you have to look at it as this idea of club of life, and the members in that club, you see.
Oh, yeah.
So you have that old club that Mr. Tan was a big man, you are a small boy.
Okay.
But today you are not, right? You have students, you are doing well. So I think you need to look at yourself differently. This idea of reauthoring the life script,
Okay.
And then remember the old...
So I should sack Mr. Tan.
Wow, I think something like that. I mean, he has started his work, okay. So there's no more needed, right?
Okay.
So if you think this way, then it may help you feel a bit better.
Yeah, but I must get rid of that lousy feeling. It's a feeling, I know it, but it comes, I think you have to work at it to get it out, get Mr. Tan out of my life.
So this thing called remembering,
okay.
I think it's quite important. See, reauthoring. Okay, yeah. So how you're telling me that something happened to your
No, I think
niece or something?
No, I think before that, maybe maybe you can help me do something about the paper. Let you have a look at it,
Yeah. Okay. I think so, Well, how do you know that paper is bad? Is it stated that it's not?
Not really, They just say this part no good, must be right here, But I suppose, well, if you think about it well, that's the life of academic, write and rewrite and so forth, So I suppose maybe you can help me just look at it and then I think send it back again, and see what they say.
Sure, I'm sure we can do something to that, right?
Yeah, but
that's called social support, right?
Yeah, but I think it's something more to it, right? Because of all this, just before I just came here, my sister had called me up,
right,
and say that my niece, my niece who is in final year medicine, undergrad here, that she freaked out, No, she didn't very much, she just freaked out, and she didn't want to study, she doesn't, and so forth, and asked me to counsel her,
Right.
So I told her, okay, I'm meeting my good friend Prof. Go. I think I'll ask him to counsel her, okay? So maybe you can tell us how to do it.
Well, this is something that I do often, at least before exams. There are actually 5 things to remember.
5 things, okay?
So maybe we start with the first one.
Okay.
And the first thing is to eat the elephant in parts.
Oh, okay.
What it means is that, well, if you try to attack your work in one go, obviously tough. But if you can divide it into parts, and then have some time for each part, it's going to be more doable.
It means that it's called like what you say, reframing, reframe
right.
the such a big fantastic things to something you can eyeball and you can use it.
Correct.
Okay.
Reframing. You see.
Okay.
Then the next thing is this 2080 rule. What called Pareto principle. Actually, it's quite useful. Of course, you can apply it many ways. That's something like 80% of your problem is caused by 20% of the people you know. But here, let's look at your niece. What's important to let her know is that actually 80% of the questions will come from only 20% of her coursework.
Okay, that's NUS secret.
Of course, the secret is to find the right 20% of the coursework to study, right? And they talk about this question of what cannot spot question, must study all. Yeah, of course we study all, but you must remember something, you see. So must remember the 20%.
Yeah, actually, sometimes too much worry about the future is bad, lah. And so anxious of what will come out and what you will some nasty examiner or setting some funny questions. All this will just create chaos, lah.
Yes.
Yeah, I think I think it's important to be mindful of the present and not be so.
Yes. And it's also part of problem solving, lah. I mean,
Yeah.
The third thing is this thing called good days and bad days. Well, we have good days, we have bad days. So if you don't do well on the bad day, it's okay, lah. You know, I mean, doesn't mean that you don't do well, you fail the paper. You think you'll fail, but you may not fail, you see. But at least accept the fact that, okay, that's my bad day, lah. I tried my best.
So there's something like what we call process work, right? How to manage polarities. Now accept the fact that,
polarities,
well, if you are fantastic, you may be an A-star student, but one day you may fail. So if you accept the fact that you may fail, at least you know how to manage it when it comes.
Correct.
And you not let the whole thing upset you.
That's right.
So I would say I think that's
part of life. Do it again. There's a supplementary. Okay. Do it. Just do it. You know? Then of course the next thing is this thing called deep breathing exercises, muscle relaxation, what I call centering, right? That's quite important.
Yeah.
In fact, we should spend some time doing that.
Yeah. So that's not time wasted, actually.
No,
otherwise, the time wasted actually, let's get session in the body, her mind, the ability to study and to focus. Otherwise, she just freak out.
Correct. Okay. Right. So the last thing is this thing called rest. I think if you're tired, you just cannot study. Rest is the right thing. And as the saying goes, 12 o'clock marks the end of one day and the beginning of next day. Okay. So must remember that if you pass 12 o'clock, you're actually cheating on the next day.
Okay.
Time to go to bed.
Okay, I think well.
So 5 things.
I think so. Since she's in the audience, I think well she knows it. So I asked her to come and see you after.
Later. I think we Prof Kwa is coming up.
Okay, Prof Kwa. Okay. Get Prof Kwa up. Come.
I think it's about question time now. Now, campus mental health is not just about students under stress. Last week I was asked to see 2 professors who have sleep problem in the NUHS clinic. So it's about all of us here. Okay, so it's question time now. Anybody has any question? You come to the aisles, introduce yourself, and shoot. In fact, there are 2 questions. Someone asked me at the foyer. Firstly, what is the neurobiology of brief integrative psychological therapy? I can help you to answer it, but it will take another half an hour, or Professor Frank Woon can help you out to understand it. The neuroscience of it is not just talking about, there's a neuroscience involved in it, right? The second question someone asked, can this therapy be used for internet addiction? It's quite common among students and staff. Any one of you?
Well, okay, maybe I make a start and then see whether we could chip in. Neuroscience, certainly we understand the mind a bit better now. That we have the neocortex, which actually help us to do fine discrimination work. And there's the older brain, which actually more for survival. So if you were to meet a car charging towards you, okay, what do? You jump, right? Or should be run down by the car. Do you remember what is the color of the car? Maybe. Do you remember the number of the car? Probably not. This is why. Because at that moment of time, survival. So your discrimination, forget it, you're not interested in that. Right? Now, in other words, we respond. We respond by using the older part of the brain for survival. But when it comes to study, it's different. We use the new brain. And the new brain can get tired. That's why when you're tired, the poor new brain cannot work. You've got to go back to the old brain, which is to go and sleep. So, and once you sleep, then you recover, then the new brain can take over. So that's certainly one application of things. Right. Of course, the other thing is this cognitive redefinition. They say that if you change your perception and you change your life, that is quite true. So again, what controls your emotion? There's certainly one part of the brain, the hippocampus, that control it. But if you are able to use the new brain to control it, then you are better. And so on and so forth. So maybe back to you, Chairman.
Anything for internet addiction?
Actually, this VIPT, which the 3 Ps and the C come about. Someone asked me, do you have evidence-based? No? Is there research into this and so forth? The answer is that we are very practical people. We are looking for a teaching model, a model to teach and practice. And maybe, of course, later we will do research and so forth. Okay? But all this, what we are talking about, is that you derive from lots of research and lots of established psychological principles. It's only where we have simplified being teachers, we have, in a way, we can deliver and we can teach. And we believe it's useful. People can understand. Otherwise, if I talk about mindfulness and the process work as Gestalt therapy and tell you all what field therapy and so forth, I can spend. You can attend a long course like me, spend 2 years in doing a master's to understand all this. So, yeah. But I believe that that's why the 4 of us came together, a few of us came, and we developed this. I think it's useful, and I believe that people will benefit from it. And after all, that's what psychotherapy is for, right? Not as an academic discipline, but it's something people can use and can benefit from it. In fact, before I came into psychotherapy, in fact, I didn't understand a single thing, very confusing to me, a lot of terms and so forth. So it's a challenge putting it in a very simple format.
Right. Any questions from anybody from the audience? Certainly, yeah. There we have it here. I'll give to you later on. Yeah.
Good afternoon. First, my comment. This is the first time I have seen such a very creative and imaginary summary, recapitulation of the talks by way of skits. All right? Now, regarding all these tools, CBT and so on, there are 2 levels. One is when you are normal, you are in control of yourself, then it's very easy to apply. Right? Just remembering what you learn and so on. But the problem is that when you have a lot of symptoms, when you're very depressed, when you're down and out, how do you advise them, how to motivate them to remember and apply? Thank you.
Okay, I think you got a very good point, very good back question. Of course, depends on the patient. First, I think some patients need psychiatrists, needs help in form of medicine and so forth. If you're very depressed, you need to go and see Kwai Hiok. And that's it. Now, second level, of course, is that at the same time they'll benefit from professional help. We have psychotherapists, trained counselors in our department or in university, and they are trained to help you. Because you're right that the problem work, which I see CBT, is actually you can't really apply it when your world is in total disarray. Of course, therefore, we must center the person first. We must do process work. Okay, we can do narrative work, which is pattern work, and sometimes we just do relating work. We don't do any of this. We just relate to the person as a person, create a connectiveness between you, a person, and the client, because the whole world is finished. There's nobody. So at least one person relates to them. So after that, when they are down, when things are settled down, they are centered. The concept of centering is very important, because if you are totally not centered, you go all over the place. How can you ever do anything? So centering, mental centering is very important, and physical centering, and so forth.
Yeah, perhaps I will add this idea of major, minor, or your 80-20 thing. So 80% of the time or more, we probably are able to cope with all the struggles in life. It's only a small minority that really go to a rough patch. And in that rough patch also, many of us actually learn to rescue ourselves. Of course, what is important is to also tell everybody that there are certain things that we can't rescue ourselves. That's why you need the psychiatrist, the family doctor and whatnot. So it's also important to know that limits. So as you rightly said, look, if you think that situation is really bad, you really should not proceed to fight it alone. You need to call for reinforcement. In life, that is also part of the struggle, part of the wisdom. When you call for reinforcement, you see. Depression, certainly we can use all the pattern work to try and help ourselves, but Sometimes it's difficult because depression has got many angles to it, and whether is it just situational or even deeper than that. So even deeper one, they may even need medications and so on. So this is for the 80% that we can do ourselves. The 20% we have better call for reinforcement. And I suppose that also goes on to this addiction thing. Addiction, you can try to change people's behavior. If they are only early addicted, it's easier to change. Where more entrenched, it's harder to change. But even then, there are such things of trying to get them to reframe their mind. For example, there's Alcoholics Anonymous. They have actually a sort of a message, or rather a prayer that they recite to acknowledge that alcohol is a terrible thing, that you want to live just for the day. So actually you're reframing from being totally powerless to be good for that day. So there are these kind of tools that we can use. Right?
And actually, I know that the hot topic this week is religion. And this is a secular meeting. But I want to say that, yeah, the spiritual component is important too. And you can see, if you look at all these three P's and see, a lot of many religions do incorporate such practices. I would say the other way around now. Maybe such practices are learned or copied from religious traditions. Okay, you can see prayer, meditation, and so forth. Okay, these are all centering. All these are actually principles that many people who are practicing religion, whatever religion, they do use too. Right? I mean, if you look at Taoism or what it is, Muslim, Islam, Christianity, okay, there are actually all these are sound principles.
When Professor Aaron Beck first came to England to propound his theory, he called it cognitive therapy, he didn't call it behavioral therapy, and he told all of us that it's more appropriate for mild depression. So for severe depression, you still need some medication. A couple of months ago, I saw a lady who had postnatal depression, and she's a lawyer, and she told me she went to Borders to buy about 5 books on CBT to read, but couldn't get out of depression, and all she needed was a small dose of antidepressant to lift up her mood, because it's very severely depressed. I couldn't even concentrate on her reading. So it's useful probably for mild to moderate. For severe depression, as I mentioned, maybe a medication is useful. But often in our therapy, we combine both together. But also the challenge that Mr. Wee gave to all of us was whether what we know can be translated to something useful for people in the community. They learn some skills, that they know what to do. And some of the skills they mentioned, there are many more other tools that we probably need to teach people. In the same way that I spoke to the Indonesian psychiatrists and the government after the tsunami at Aceh, 1 million people displaced on the beach of Aceh. You can't provide counselors, all of them. So the same way we told them these are some of the things you need to know, you can prevent them, and where to seek help. Where to seek help if they have more severe psychological problems. Okay, another question? Jim, I thought you would ask a question from Faculty of Medicine or students under stress.
Yeah, yes.
Sorry.
Yeah, the reason I rushed here to attend this talk is I thought I can pick up some, information, some skills, so that I can counsel my daughter. Lately, because my daughter has problem with sleep, and she blamed it on, having to work so hard in a JC and she asked to see a psychiatrist, which I have arranged for her. And now she is already in the 3rd sessions, going to see a psychologist after a psychiatrist. So she was given some antidepressant medication. And it didn't work out well because she get even more tense and more irritated, and I feel that the medicine is not really helping her to reduce her anxiety. So I told her to stop. Then, I mean, it's good that she is very concerned about her studies. She wants to do well. And, but then it hurts to see that, you know, she got to go through so much, you know, that she couldn't sleep, and she keeps saying that she got not enough time. So I don't know. I'm trying to help her, but I have my limitations because I don't know what to do also at times. So, but I believe that the medication will not help her in the long run. She's a very hardworking girl, you know. She's very anxious. She must get A's. You know, she's aiming very high. She must get A's. But I told her it's okay to have a B or a C as long as you have tried your best. But I guess a lot of students, they are going through very tremendous stress. You know, especially, you know, she comes home after 9 every day. You know, it's worse than a working adult. You know, sometimes I feel that why does she need to go through, you know, life in this manner?
Okay,
maybe,
can I ask the speakers in terms of, I know one of the areas of research in our department is resilience, not only for old people, but also young people can go through life. You know, what can they do? You think there's something you can do in the BIPT? I know we're running a course in June for the schools.
I think there are some sort of suggestions we can offer. I'm supposed to, can I ask you 2 questions? So what class is she, Sec 2? Oh, sorry, JC. JC 1 or 2? JC 1, right? And then is she in one of the good schools in Singapore? Neighborhood school. Okay, I suppose a few things. Certainly JC1 is a transition in life. In the sense that particularly when you move from O-level to JC, that different style of learning and teaching may be a factor. Yeah, because what I felt when I was in JC1 was that suddenly there's nobody to talk to me to teach me how to study, you know. So I don't know whether how much is that factor. So like all things, diagnosis before treatment. I think it's important to maybe talk to her to find out what actually is troubling her. Is it no confidence? Is it too much work? Or is it too much pressure from teachers or too much pressure for you or your husband? You know, I mean that may, sometimes that is a factor. You know. So I would say that go and see your good old family doctor and say, look, you know, sort of bring her along and have a chat and see what is the problem, where is the problem. Once you know where is the problem, you can then know where is the treatment. I suppose can even go back to the psychiatrist to say, look, doesn't seem to be working, you know, so what is his worldview and that kind of thing. But you go back to the fundamentals that I talked with Prof. Cheong. It's a question of trying to define that work. If you don't define that work, you cripple the poor girl. You know? And also this mental load. Often it's a mental load. Can we accept the fact to be just good enough?
I think it takes time. The girl which I mentioned just now, the student which I counseled, I saw her for 6 months, almost weekly, once a week. It's not, and you have to go through various phases. You can't introduce all these 3 P's straight away, you know. You have to relate to the person. The person need to be feel loved, feel wanted, especially as a parent's view. So I suppose you should not. I mean, the thing is that if you see you every time worried about her, she'll be more worried. And just relate to her in unusual, just concern and so forth, and you just have to connect, and then slowly you have to move on, then settle, and then you can slowly work on it. And I think you probably need professional help. I think you get a professional counselor to it.
Okay, I have to stop now. Everyone's signaling me to me this time. All right, I'll ask Professor Goligan to give you a take-home message. Okay,
I think the message I see important is to go on this idea of centering. We need to center ourselves, and the details I talk on is the way to help you to center yourself so that you don't fall.
Yean?
Okay, just remember simple tools which you can apply every day of your life, which is the 3 P's or 3 groups of 3 P's to settle yourself. The first P, pattern work, to get the preferred story, and you use the 4 R's to get a preferred story. Reauthor, remember, reframe, and then tell and retell. That is the first pattern work. The second one is problem work, the problems that pops up, and you can challenge these negative thoughts in you, and you replace them with more optimistic and more positive thoughts. And lastly, about your psychological processes, mindfulness of the present, and of course managing your polarities, and managing involves owning, accepting, and of course handling it if it gets in disorder.
I'm supposed to put everything in a nice shopping bag, all of you, for you to bring back home.